everybody. Hope you're all doing well. I wanted to make this video hopefully to help others who are going through similar things, or if you have a family member or friend you're concerned about, that maybe some of the information in this video will help you or help them to get the care they need to improve their health and their overall quality of life. I've been suffering from chronic neck issues, spine issues for many years. I've gone through different cycles of improvement and worsening, where my cervical spine would get out of alignment and my neurological issues would get severe. My neck would pop back into place and things would improve. Also, I could sleep in the wrong position, wake up, and way up in the in your skull, it would click and it would be out of alignment. We know now that that's cranial cervical instability and an Atlanto-axial instability. It's the top vertebrae that go up into your skull. When they dislocate or sublux, they can put pressure on your brainstem and create all kinds of problems. That's part of what I've been dealing with. Over the summer, I was moving some furniture. I lifted a heavy mattress. My spine got compressed and it gave out where in the weak points. After that, things got really, really bad. Having difficulty walking, legs are super heavy, muscle spasms, tightness, also muscle weakness, my hands trying to open a jar, things like that. Any lifting, any bending or twisting just aggravates my spine, aggravates my condition. All the neurological issues get worse. This post was from August 5th in 2021. At the time, my entire spine was on fire. I had burning pins and needles radiating out through my arms and legs. Whenever I'd lean forward or backward, I would get these electrical shock sensations. I now know that that is called Lhermitte's sign, indicative to cervical myelopathy and spinal cord compression. I had extreme vertigo, nausea, which was made with movement, muscle spasticity, really bad muscle cramping and spasms, muscle fasciculations, bladder issues, severe pain in my cervical, thoracic, and lumbar spine, and everything was getting much, much worse with any movement. Laying down and keeping still was the only way to get any relief. Other neurological issues were heat intolerance. It was like magnified times 1,000. Temperature, cold, noise, bright light, everything, hypersensitivity, difficulty breathing, heart rate abnormalities, dysautonomia, which is your autonomic function, heart, breathing, digestion, etc., all impacted negatively by this condition. There was obvious spinal cord compression. The symptoms were unbearable. Headaches, blurry vision, extreme pain, pins and needles, nausea beyond explanation, unbearable, horrible symptoms. And I went and saw local doctors, had MRIs done here, and in the end, we end up seeking care elsewhere. And that's when I discovered Dr. Hauser and the caring medical team, and we began the process of communicating with them and sharing my records and my symptomology and my history. They did an intake. We did a phone intake. There were several phone calls. And we had the patient evaluation appointment. And they decided that based on my history, my condition, and my my findings from my MRIs that I was a candidate for prolotherapy. That to stabilize the cervical spine so that the dislocations and subluxations that have become so frequent and damaging, that the prolotherapy would help to stabilize the tissue, the ligaments, the tendons, the soft tissue by doing these injections. The alternative to that is cervical fusion, which would be fusing the bones together. That's a whole nother conversation. The way my health has been, I didn't feel comfortable doing any type of anesthesia or any type of surgery where they were going to cut me open. And, you know, the whole pain medicine, antibiotics, months of recovery, and then to have limited mobility, limited range of motion, and no guarantees that it was going to help at all, really. And my research turned out that a lot of people were actually worse off after their surgical fusions. I'd like to mention I'm not affiliated with Caring Medical, and the reason that I chose to go to Caring Medical was that Dr. Hauser is a neck specialist. They provide specific diagnostic testing and specialize in these neck issues. So if you or anybody else you know is having neck problems, I highly recommend going and talking to the staff at Caring Medical, having an evaluation done, doing the diagnostic testing that they provide, so you can get the answers and the accurate diagnosis that you need. They also have numerous educational videos on their YouTube channel at Caring Medical. You can also check out more information at caringmedical.com. How I found them was I was looking for alternatives to the traditional fusion surgery, screws, rods, you know, stainless steel in your body, being cut open, cutting into your spinal canal. I was trying to avoid those surgeries if at all possible. Prolotherapy and stem cell injections offer an alternative to traditional surgery. To help give some perspective on who I am, a little bit about me. I've been teaching surfing and stand-up paddling for over 20 years. I've also competed professionally as a tandem surfer. I'm a professional photographer, film producer. I'm an animal lover, Red Cross certified lifeguard. And I've always been very health conscious. I eat mainly organic diet, very specific foods, very health conscious. Trained to be in the best physical condition possible for my sport. Here you can see me training back in 2016. Since the surgery and the antibiotic, my body has just been destroyed. Here's one of the video clips I made describing my condition at the time. Please make it stop. This nausea is so bad today. Again, just from a little bit of activity, trying to get my stuff ready to travel. This nausea is just unbearable, and it's hard to think and talk. And this cramping in my calves and my legs is just freaking so painful. The pain in my spine. It's just getting so old. I really, really, really need some kind of relief at this point. December 3rd, went to Next Health to get a vitamin IV to hopefully restore some energy and function prior to my trip. December 7th, departing Kahului Airport, headed for Fort Myers, Florida to Caring Medical. So here it is, the morning of December 13th, 5:45 a.m. Here we go. We're off to Caring Medical, Fort Myers. Here we are at Cary Medical, Florida, to see Dr. Hauser and for the evaluation, the testing. The first test was the DMX, Digital Motion X-ray. They put you through a motion X-ray. It creates a video of the X-ray. Unfortunately, I had to move my neck in all kinds of different directions: extension, flexion, left, right, twisting, turning, open mouth, ear to shoulder, and I've had to keep my neck in the neutral position to prevent things from getting worse. So I understand the test is required because they need to measure the extent of the instability, which it's very, very helpful with. Unfortunately, for people like me, you pay a really big price for doing this test. My symptoms were horrible, and you'll find out more about that as we go through the video. They also did a number of other tests to assess vagus nerve function, internal jugular and carotid artery measurements using high-resolution ultrasound. They're also looking at your optic nerve sheath, among other things. We'll go into more detail later in the video or in another section. They're very thorough, and these types of tests you wouldn't necessarily get at your conventional medicine doctor. It takes a specialist that provides this type of testing. Thank you to Dr. Hauser for allowing me to film my experience. So with no further ado, we're going to go to the video with Dr. Hauser giving some explanations of what he sees and his thoughts and feelings, and our final set of diagnoses we'll be sharing at the end.
So all this fluid like there,
Mm-hmm.
and here, so you have, these are just signs that you have a blockage somewhere here. So you have, what we term increased brain pressure, and then all these things are flat here. So all the pressure here is screwing up your brainstem, basically.
How about on the top there?
Yeah, same sort of things. You're getting brain atrophy.
Mm-hmm.
Yeah, you're getting brain atrophy.
Yeah, I noticed on the coronal view too that it was pretty evident.
Yeah.
What they call normal.
I know, I'm sorry about that. Some people would say, one of your ALARs, they'd say the white there, maybe there's a sprain of your ALAR.
Mm-hmm.
Like some of the purists would say, there's a sprain. And these I'm just eyeballing this, but it looks like your optic nerve sheaths are real high. Mm-hmm. So that's another sign of intracranial hypertension. Some of this could pick up MR angiogram. Okay, so let's look. So your right, looks like your right jugular dominant. See the left, it's getting compressed.
Mm-hmm.
Your left jugular is getting compressed. It's like what normally happens is if you get the pressure off, like cysts and things,
Mm-hmm.
they just go away. So it's really just about us getting rid of the pressure. Because you could look at this and there's lots of different things, but it's just like you just get rid of the pressure and then.
And see that.
The brain, as you know, has tremendous regenerative capabilities. You just got to get the pressure off. It's like the vagus nerve. To me, it just looks like it's high brain pressure, like real high. What was your thoughts on this brain?
He definitely has some instability. C3, C4, C1's real high.
Oh,
he has
okay, nice.
Severe instability at C1, C2, but mostly on the left, I believe. His right showed like a more mild instability, but it was much more severe on the right, or on the left.
And the neck vitals?
It was some of the vagus and optic nerves.
Okay, yeah, that's what it looked like.
Yeah.
That's what it looked like.
His vagus nerves are like 0.7, I think, on one side.
So it looks like his C2's rotate a little bit to the right.
He has a a like wing coming off. But when you see the styloid view,
Okay.
there's like something in the posterior part of C2. There's like a big spike coming off of it. You'll see this
C2 spike.
C2 spike.
We'll name it after him. The Sufran spike.
Ooh, I like it. There.
I had all my teeth pulled out because of this, because I was trying to get rid of the symptoms.
Yeah.
One of the
I'm
views.
sorry.
It's not your
Now you got nose teeth. Well, there's rotational instability. That's on the whole. Why don't we agree though, Ron? At some point we'll do a CT scan like in the office.
I got like
No
something about
Sufran spike.
No spike.
No. I got your hopes on. Let's say the primary lesion is compression of the carotid sheath on the right. I think that's the primary lesion. Thank you, Dr. Hauser. Ron, let's just do that. Like, we basically last week we got to install the CT scan, but the radiation exposure is almost zero, and it's going to give you and me a good 3D picture of what's going on. But it seems like you're going to be a really good candidate for what we do. I just want to see the anatomy a little bit more, because obviously the symptoms are devastating to you. And so obviously from this, you have the C3 vertebrae has to be moved forward, right? Because that'll open up some space, or C2, I guess C4, yeah, C4 has to be moved into. So I'd say in the ideal setting, I'd say you have to see him like, let's say a week or something, and I could start prolo like sometime next week. That's what I would do.
Okay.
Just let him get you started a little bit. As far as like the anatomy, the adjustments, there's nothing high velocity, the weights, see how you feel, then I'll see you sometime next week. And we'll start prolo.
Okay.
And I normally see you about every 2 weeks
2 weeks.
for prolo.
Okay.
And in between, you'll be seeing Dr. Hutchinson just for one of the goals is just to open up your jugular veins, so you drain your brain better when you're upright.
Okay.
But right now, once you're able to, you should lay down every hour for 5 minutes, just to get your pressure down.
And so the treatments you're saying every 2 weeks apart, as opposed to the 4 to 6 weeks?
Yeah, if you're living here, that's how I would do it, because it's not practical to go from Maui to here. Initially, I see you a little bit more frequently just because I'm trying to, get you over the hump.
Yes.
So I'm going to say every 3 weeks. So I do 3 visits every 3 weeks, then we'll do the 4 to 6 weeks.
Okay, great.
That'd be the best. Okay, Brad. Okay, look forward to seeing you.
Hey, thank you for everything. God bless you. What is cervical instability? Cervical instability occurs when the connective tissue, the ligaments and tendons, the soft tissue that hold the spine in place, the vertebrae, the bones that protect your spinal cord, begin to move excessively, front to back, side to side. When this occurs, it can put pressure on your spinal cord and cause a number of different neurological issues depending on the level of where the instability is and depending on the severity of the instability. For me, the cause has been antibiotics. I've learned recently that the antibiotics I took are what have pretty much destroyed my connective tissue. Ever since the antibiotics, my ribs dislocate, knee, shoulder. I have horrible instability in my spine, not just in my neck, but throughout my entire spine. My first treatment was scheduled for December 20th. Unfortunately, my ride called that morning to let me know he could not take me to my treatment. The facility requires that you're escorted to and from, but also during your treatment. You need someone at the facility. Unfortunately, the 2 backups he had also were not available. Fortunately, the caring medical staff was able to reschedule me, but not till January 4th for my treatment, which set me back 2 weeks. The original plan was when I arrived in Florida, I would stay with my friends, my support team, for the first 2 or 3 weeks while I went to the patient evaluation, and that they would take me to and from my doctor appointments. After the no-show on the 20th, I really didn't feel that they would be reliable enough in the future to depend on them. So at that point, I was on my own. The doctor gave me a heart rate variability monitor to monitor my heart rate. Unfortunately, after the DMX, my autonomic symptoms got much, much worse, along with the pain and the nausea and everything else. My heart rate, I started having extremely high heart rate and low heart rate, which are tachycardia and bradycardia. I've attached many of the monitor results to give you an idea of what I was experiencing. Tonight's really rough, and today I've been really wiped out, but yesterday was the day we were supposed to do the first procedure, but it put a lot of stress on my heart. That experience, like, a lot of stress on my heart. I was already pretty weak and had having a lot of chest pain, but today is much worse. Actually, tonight I coughed a few times and thought I was a goner, but that coughing almost stopped my heart. I was down for a good 3 or 4 minutes, just trying to breathe and keep it together. Tomorrow I'm going to go for an IV. I'm so depleted again. A lot of stress, some bad food, and not much sleep. It's really adding up, taking its toll. I continued to have major heart issues, so I continued to monitor what was going on with my heart with the HRV monitor. And I was having some pretty severe spikes, as much as 380, 385, rapid heartbeat, and then as low as, I believe, 40, 38, and just alternating up and down. Eventually I went and got the IV. I believe this was an error. It turns out that when you have intracranial hypertension, adding extra fluid to your system will actually increase the pressure. Not sure, 100% sure, but I started coughing up foam right after that. So my heart rate continued to go crazy, and it was in literal hell. It was scary. It was Christmas time. I was by myself, and thankfully, at this point, I was speaking with my friend Jennifer in California, and she volunteered to fly out and to help me and to make sure that I could go to my appointments and to my treatment. And at least for now, that would be the plan. I continued to have these major heart swings. I just packed my bags and basically was ready to die in a hotel by myself at this point. It was so gnarly. I can't even put it into words. Thank God Jennifer wanted to come out and help. Thank you, Jennifer. Can't thank you enough. Hi, Jen is here with us, and she's going to go ahead and describe what she does at the hospital.
Hi everyone, so I'm a licensed clinical social worker. I am currently working at Sutter Roseville Medical Center. I've been with Sutter for about 22 years, and my current role is I'm a cardiovascular coordinator. So I work with heart failure patients and also patients that have come in with heart attacks. We meet with them, we do education, we meet with families and also provide education to them. Make sure that they have the appropriate follow-up in place once they leave the hospital, and if not, try to help coordinate that care for them.
With your experience in the cardiology department, were my heart monitor readings concerning to you?
Yes, I was very concerned about you and your heart. You were all alone, and you were sending me readings of your heart rate that were super high and super low. And at times I was concerned that something was going to happen to you and I wouldn't know it. And then when I finally was able to come and help and see what was going on with you, your heart rate, your extremities would become extremely cold. You were nauseous, dizzy. I couldn't leave you in Florida all alone.
Thank you very much, Jen, for all your love and support. This was almost Christmas Day. So I decided to do video instead of trying to type things out. Today is extremely bad. I woke up soaking wet, cold sweat, feeling miserable, and then coughing up white foam. Really deep cough. There's congestion in my lungs. Like, it's really extremely cold hands, feet, cramping legs. All the other problems too, the pressure in my head, headache, pain, but this coughing up the white foam and the cold extremities, it's from my heart. And so the other day when I had that stressful situation where I couldn't go to do my procedure, it really hit me hard. And since then, my heart rate has been really erratic, really bad pain in my chest and my heart, having, shallow breathing and super exhausted, dizzy, nauseous, and just really, the coughing, when I cough, it jars my neck and my head and makes everything worse. So I have a heart monitor from the new doctor, and I'm having spikes of 380 beats per minute, 265 beats per minute, and as low as 33 beats per minute. Those are really extreme lows and highs. And it's due to my neck and the pressure in my head, and that's what originally caused these heart issues. And the reason they got so bad is because this has gone left untreated, not diagnosed correctly, and this is the long-term results of the negligence and failure to follow the standard of care by my past medical providers. Thank you, everyone, for your prayers and your love and support. I'm not sure how much longer I'm going to make it, God willing. I'll stay with you guys for longer. If he has work for me to do here, if it's up to me, I ask him to just please take me home. And, we can, sorry, it's hard to concentrate. Well, I wish you guys all a very Merry Christmas, and please let the people you know that you like and that you love, let them know how much you love them. Hug them. And remember, the most important things in life are the people, the family that you hold dear to you. Everything else is just everything else. Thank you, God. Thank you for all the good times, the bad times, everything in between, all the beautiful people I got to meet and share time with. Thank you for all the waves. Thank you for everything. for the pain, for the joy. I love you, Jesus. Please help restore me or take me home. Okay, I love you guys. God bless. Aloha. I didn't make any videos on Christmas or the day after. It was so horrible. I didn't even want to share any of that with anybody at the time because of the holiday season. I didn't want people to freak out or get worried, so I just ended up not sharing anything after a while. Recovering slowly from my Christmas Day excitement and relocation. I got my heart rate down to, resting heart rate. We're keeping it like below 200 now. Heart's pretty weak. Get some pain there and a little shortness of breath and really, really weak and exhausted, but having insomnia. So sleeping with my collar to keep my neck from getting more aggravated, and it's been pretty rough. So I'm just gonna kind of wrap it up for now. Brain function is low. I need to get some food, and the pressure in my head is really bad. And pain in my eyes. Okay, that's today's morning report. Unfortunately, the tachycardia and brachycardia continued. My heart was just out of control. Part of the issue is the vagus nerve, also pressure on the brainstem. As you can see, my temperatures were all over the place. As far as the brainstem, the medulla is at the bottom of the skull, going into the spinal cord. What part of the brain controls the heart? The medulla. The medulla is essential to survival. Functions of the medulla regulate many body activities, including heart rhythm, breathing, blood flow, and oxygen and carbon dioxide levels. Damage to the vagus nerves. The vagus nerve represents the main component of the parasympathetic nervous system, which oversees a vast array of crucial bodily functions, including control of mood, immune response, digestion, and heart rate. It's very important to have healthy vagus nerve. Mine are damaged. What are the symptoms of brainstem compression? Brainstem compression symptoms: dizziness, fainting, blurred vision, visual and auditory disturbances, flushing, sweating, tearing of the eyes, runny nose, vertigo, numbness and tingling, and difficulty swallowing or talking, and drop attacks. Into January 1st, January 2nd, the heart abnormalities and temperature, everything continued to spiral out of control. Here's a video of my calf muscle. You can see random muscle twitching, muscle fibers firing. These are called muscle fasciculations. We are January 3rd, going to our chiropractic evaluation and adjustment with Dr. Hutchison.
Okay, so we're fitting Ronald for his first round of cervical curve correction, and he has a 5-pound reverse chest weight and a 1-pound halo weight on. So when you're wearing these weights, Ron, we want you to have your feet nice and wide, strong, abs engaged, glutes active, chest rested, and then you're envisioning, we just did this together, you're envisioning that this weight around your neck is kind of pulling your neck up this way, right? And then your chin is down a millimeter, right there, good. Can you turn your body to the right about 60 degrees with your feet as well? Turn your feet, good, right there, feet a little bit wider, Good. Abs engaged, glutes active, resting your chest, envisioning that this weight is pulling you back and up, and then the chin is down that millimeter. Beautiful. So this weight is on parallel to the ground. The nose is directly forward. This is pulling you back. You're resting your chest and arms. Exactly it. We're going to have you wear this. Do you feel okay?
Mm-hmm.
For 2 minutes, 5 times a day. Okay? And we'll show you what it does to the neck curve. Mickey, why don't you show them real quick? Because we got a good picture here. So basically, when Ron came in, let's see, where were we? So this very small subtlety. So this is when Ron came in. And let's see where we got it to. And this is where we got it to. So now we have this like a little bit more of a curve here, and it's really tall on the top. And before,
With the military neck before, right?
well, it's very small difference. So, but I think it's totally the right thing. So before we had this going on, and then down at the bottom, what you can't see is it, which I did this image for, is it was really going on a harder angle down at the bottom. So with the 5-pound reverse chest weight, if we were to zoom in on the lower angle, which we can actually look at, it wouldn't be quite as sharp as this one. So we've reduced that sharpness in the very lower neck, and we're starting to try to, by having him, if you watch me, by having him go like this, what that's going to do is actually going to barely separate some of the spinous processes that are compressed posteriorly. So we're working on a few things, but definitely I think this is better for him. He doesn't get any worse symptoms when wearing this. So let's have you do this at least 2 minutes, 5 times a day. Are you going to stay in town for a while?
I'm here till Friday, and then
Is Ron going to stay in town?
yeah.
Okay, and then we'll recheck it within about 10 to 12 days, okay? Perfect, thank you.
The digital motion X-ray results confirmed cervical instability from the posterior longitudinal ligament and posterior ligamentous complex is indicated by anteriolisthesis at C3 on C4. Cervical instability from the capsular ligament is indicated by intervertebral foraminal encroachment on the facet joint at C4, C5 bilaterally. Cervical instability from the atlas and atlanto-axial C1, C2 capsular ligaments is indicated by an overhang of the lateral mass of C1 to the left. And there's also straightening of the cervical lordosis with disc narrowing and osteophyte bone spurring at C4, C5 and C5, C6. The chiropractic with Dr. Hutchison went really well. He's very mild, subtle techniques to realign the spine and other parts of your body as well. Here's my results, if you'd like to read them. January 4th, we arrived at Caring Medical for the prolotherapy treatment. Dr. Hauser pulled Jennifer and I aside to review the CT scan we had done on December 13th. The CT revealed spinal canal narrowing all the way down to 5.9 millimeters at the C4, C5 junction. The osteophytes are pressing into the spinal canal. Dr. Hauser mentioned there wasn't anything he could do to help with that, and that by creating more space with the prolotherapy, that eventually the body would dissolve the osteophytes. After reviewing the CT scan, we agreed to move forward with the prolotherapy treatments. Here I am getting the 60 to 80 injections into my cervical spine. It was extremely painful, a little bit worrisome, but I had confidence that the doctor was very accurate and had done so many of these that I could be confident in his ability to do this correctly. The procedure went well, and at this point my health had declined so much that staying by myself wasn't really an option, and Jennifer had to travel back to California for work and for her family, so I opted to travel back to California with her at that time to have someone to be able to travel with and someone to help me out. Stayed in California for 2 days. The pressure from the flight, the intracranial hypertension was so bad. At that point, I just wanted to go home to Maui. So came home to Maui and rested and healed for almost 6 weeks. After returning home, went by a couple weeks. Then I think it was around February 6th, started to have really bad heart problems in the middle of the night where I had rolled over onto my side and the heart problems just went out of control. It's about 2 a.m. I couldn't sleep. Trying to sleep on my back, and I rolled over onto my left side, and suddenly I started to get very hot. I broke out into a cold sweat. My heart was racing, so I got up and I got the heart rate monitor, and my heart rate is all over the place. So I'm trying to eat a little something to see if that'll calm things down. And I'm gonna do the other heart rate monitor now to see how that works out. So I just did the EKG. It came back 2 abnormal sinus arrhythmias. I was in a cold sweat, and my heart was really erratic and racing, and I felt really nauseous, and my shirt is completely soaking wet from sweating for just the past 15 minutes, and now it's passing. So I'm gonna eat something, and I got some glucose tablets and some pretzels, and see if that will calm things down. So that was pretty scary. Just rolling over on my side ends up cutting off my blood supply. Putting pressure on the spinal cord can cause spinal shock as well. February 9th, getting some beach time, finally, some healthy food, and just a beautiful day at the beach. The sun's too intense for me, of course, so it was short-lived. And then here we are. I'm back at Kahului Airport, February 12th, ready to head back for another treatment. Treatment number 2, flying to Fort Myers. So on February 13th, flew back to Fort Myers. Jennifer came to meet me there again to help me with my second treatment. The treatment went well. Again, very painful, but this time I knew a little bit more what to expect. Unfortunately, the pressure from the flying was really bad again. The intracranial hypertension, the pressure went up, and yeah, it was pretty rough. So I was there for about 6 days, and then flew back to Maui. So it's now March 30th. It's taken all this time for my brain to work well enough to be able to finish this video and to be able to speak these different parts. It's all happened in the last week or so, where my brain function is actually returning or improving a little. Sometimes I sound like I'm drunk. Other times I have a really difficult time making sentences or carrying on a conversation. The most difficult thing is like trying to multitask or organize thoughts, memory issues. It's been pretty frustrating. All from the intracranial hypertension. So the pressure is coming down after all those flights. So things are improving slightly. As far as my situation, we're in a holding pattern. Don't have the resources to travel at the moment. The main factor stopping me is the intracranial hypertension and my neck. While I did notice some improved stability from the 2 treatments, it takes 3 or 4 to really get over the hump, as the doctor says. And so for right now, kind of pretty much where I was back in December. My symptoms aren't quite as extreme as they were, so some improvement will take. As far as traveling again, I'm going to have to either find a medication. There are a couple of medications you can take. Diamox is one of the 2 medications. The second medication is called Topramate. Not sure about these 2 medications. I did a little bit of research, but seems that, you know, with any medication, there's going to be some side effects. It just depends on whether the benefit outweighs the risk. Also, there's the osteophyte complex in my neck. I'm not sure if that can be remedied strictly through the prolotherapy. Stem cells, the stem cell injections, they're more costly, but I feel that the stem cells would most likely be extremely beneficial, probably more so than the prolotherapy alone. The other option for the osteophytes is to have them surgically removed, but since they're pressing into the spinal canal and into the spinal cord, that surgery is pretty risky. I did find a guy in Fort Lauderdale, I believe his name is Jeffrey Cantor, Dr. Cantor, has the Spine Institute. He has a hypersonic tool to cut bone that doesn't cut soft tissue. You can actually go in and remove the bone spurs without damaging the spinal canal, the cord, the nerves, all the soft tissue. That would be completely out of pocket, much like the prolotherapy or the stem cells. These things do work. They're not part of the insurance program or conventional medicine program, so they require that you pay cash. We'll just wrap up what's going on with me. So we have the intracranial hypertension, which is elevated CSF pressure in your skull. CSF is the cerebral spinal fluid. When the pressure gets too high, it will put more pressure on different parts of the brain, including your pituitary hypothalamus, the main controllers of hormones in your body. So you could have all kinds of hormonal issues, as well as headaches, vision problems, nausea. The list goes on and on. As far as the cervical instability, the further you go up in the skull, into C2, C1, C0, when you have instability up there, it puts pressure on your brainstem and anything goes neurologically. The spinal instabilities at the occipital-atlanto-axial region, also have spinal instabilities in the cervical region, reduced lordosis. That means instead of the natural curve, it's really straight. And they also have suspected C0, C1 instability. Right carotid sheath compression, so the blood supply is getting cut off in the carotid artery. I have spinal stenosis and spinal cord compression at C4, C5, and the spinal canal dimensions go down to 5.92 millimeters. Also have enlarged optical nerve sheath. That's from the pressure in the head. They said that I had some of the highest readings they've ever had in their 23 years of business. I believe they were in business 23 years. Yeah, and I have the vagus nerve degeneration where my vagus nerves are really shot. So, it's extremely important for me to continue these treatments. We face a few hurdles in returning to Florida at this time. One is the money, so we're continuing to try to raise the funds to go, and hopefully that will happen soon. It's important not to have more than 6 weeks in between treatments. I'm already at the 6-week mark, so hopefully in the next couple of weeks or month can secure the financial resources. Flying is a hurdle. Hopefully that medication will be able to help. A place to stay and to rent, that was extremely challenging. Florida, seems everybody moved there during the pandemic, and there were only seasonal rentals. So really it was about $1,200-$1,500 a week for rent instead of, like $1,500 a month for rent. I did secure a rental when I arrived there. Unfortunately, they decided to not give it to me because my friends had a GoFundMe set up for me. Transportation, rent a car, or possibly if someone has a vehicle that they want to share, let me use. I have a lot of friends in Florida. Hopefully somebody has either a place to rent for a short period of time, possibly a car to rent. There's just really limited options in Florida, especially now it's spring break. The other thing I would need is a support person. You can help in any way you can, let me know. Please reach out. No shame for me anymore. I never used to like to ask for help, but when your back's against the wall, sometimes you just got to reach out. When people work together, it's amazing what things can be accomplished. So I just have hope and faith and continue to try. Optimally, the best thing for me to do would be to travel back for prolotherapy, possibly stem cell treatments. If I did do that, I would only want to fly one time. One time there, one time back. The best way to do it would be to have the treatment when I arrive, have another one 2 weeks later, and then have another one 2 weeks later, and then return to Hawaii. In order to do so, I'd have to stay in Florida for 4.5, possibly 5 weeks, and just do them back to back to back. The other reason that's really important is in between each treatment, they check your cervical curve to ensure that the treatments are actually reinforcing the ligaments and tendons to get back to the proper curve. So you have to have those appointments in between to ensure that the weights they're giving you and the exercise they prescribe you is actually encouraging the curve and not continuing to have the straightening or making the tendons and ligaments stronger and having the spine in the wrong position. As you can see, my brain doesn't work so well. I'm doing my best to wrap this up. Apologize, it's really, really long, but there's so much to go over that just a couple paragraph summary would not have done things justice. I want to thank everyone who contributed to the GoFundMe and who pitched in any way through prayer or anything else. I really appreciate everything you guys did. Unfortunately, we managed to raise $5,000, but $20,000 was the goal, so I fell short of that goal and was unable to accomplish the mission in the time that we had hoped. If you'd like to pray, then please pray for me that God provides the resources and, people to help in any way they can. And what this means for me is, just being able to do basic chores, making my food, doing my laundry. I'm grateful that I'm able to do those things and to work on the computer a little. It does take a toll. It's hard on my neck, and it's pretty much what I have left that I can work with at this point. So thank you very much, everybody. Love you guys. Hope this helps. Anybody interested in more information, please put your comments down below, and I could do some more videos explaining more as far as neck brace and any other advice I can give. Time my neck was worse, my neurological symptoms would be worse. I've been to literally hundreds of doctors over the years, specialists, and they all pretty much said the same thing. Oh, your neck couldn't possibly be causing all those problems. Well, it turns out they were wrong, and thankfully was able to go and get the proper, thorough, accurate set of diagnoses from Dr. Hauser at the Neck Center. If you'd like to help by contributing, you can go to miracleforcaptainron at GoFundMe, or you can go to Venmo and Venmo me a donation at Aloha Visual Productions. I very much appreciate all your help, love, support, and prayers. I look forward to many days ahead and hopefully seeing you all in the future. And possibly the miracle, maybe one day I can return to an active lifestyle and, God willing, maybe get to catch some waves again one day in the future. I know it's tough for people who don't surf to understand that maybe that's just some kind of, it's hard for them to understand. But surfing is more than just a sport. It's what we do. It's who we are. And it just breaks my heart to not be able to get out there with my friends and harness the power of nature. So thank you, everyone. Thanks again. I'm going to sign out now. Just a few last words. Remember that when the odds are stacked against you, things might seem impossible. But through taking a leap of faith and going for it, you never know what can happen. If I hadn't gone and done this and gone for these diagnostic tests, I'd still be here in Maui spinning my wheels. So thank you so much to Dr. Hauser and the team. Thanks to everyone else that supported me, believed in me. And thank you to God. With Him, all things are possible. Well, we'll see you in the next video. God bless you all. Aloha.
And all that we are blessed with. And one day we are going home. Until then, I will live my life like a gift. It's not my own. I will live by your word and not by bread alone. And behold, that I can do all things. Your words is all things. I'm not just in small things, 'cause your words are true, so why